Hello, everyone. Welcome to Health Series Podcast. Today, we're going to be looking at the healthcare system of Nigeria versus South Africa. The healthcare system of Nigeria and South Africa provide an insightful comparison in terms of structure, resources, challenges, and innovations, reflecting the broader issues of opportunities in African healthcare. The first area we're going to be looking at is the system, structure, and access. Nigeria has largely public health care system, complemented by a growing private sector. The National Health Insurance Scheme, introduced in 2005, aimed to achieve universal health coverage, but adoption has been limited, covering only a small fraction of the population. Most healthcare services are financed out of pocket by patients, which limits access, especially for low-income families. Primary healthcare is often underfunded with shortage of qualified personnel and necessary equipment, especially in rural areas. Whereas South Africa has a two-tier healthcare system consisting of public and private sector, with the private sector serving about 16% of the population, usually those who are wealthier. The public sector, however, faces significant resource constraints and long wait times, though it remains the primary healthcare provider for the majority of citizens. The country is working towards implementing the National Health Insurance to provide more equitable healthcare access. In the area of healthcare financing, healthcare expenditure in Nigeria is low, with only about 3 to 4% of the GDP allocated to healthcare. Most of this funding goes towards curative rather than preventive services, contributing to preventable disease burdens. There is also a significant reliance on out-of-pocket payments, which account for over 70% of healthcare financing. Although NHIS exists, it remains limited in reach and impact due to low enrollment, inadequate funding, and a lack of awareness. On the other hand, South Africa spends about 8 to 9% of its GDP on healthcare, with significant differences in spending between public and private sectors. The private sector accounts for a majority of the expenditure but serves a minority of the population. Government financing for healthcare remains substantial, yet inequalities persist. South Africa's plan NHI seeks to reallocate resources to increase public healthcare access, though achieving financial and sustainability resource remains a major hurdle. In the area of workforce and infrastructure, Nigeria faces a severe healthcare workforce shortage, particularly in rural areas, with significant brain drain as healthcare professionals migrate abroad for better opportunities. The infrastructure is also under-resourced, with frequent shortages of medical supplies and equipment. While some urban areas have better healthcare facilities, the rural-urban disparity is stark, and many rural healthcare centers lack even basic necessities. On the other hand, South Africa also grapples with a healthcare workforce imbalance, though it's somewhat less severe than Nigeria's. The country has a relatively higher ratio of healthcare workers to the population, yet disparity exists. The public sector struggles to retain skilled professionals who often prefer private sector roles or immigrate for better opportunities abroad. Infrastructure in public hospital is often outdated, leading to overcrowding and long wait times for patients. When it comes to disease burden and health outcomes, Nigeria faces a high burden of communicable diseases such as malaria, HIV, AIDS, and tuberculosis, alongside rising rates of non-communicable diseases like hypertension and diabetes. High maternity and infant mortality rates continue to be a challenge, especially in underserved areas. Vaccine preventable diseases are also a concern, with occasional outbreaks due to gaps in immunization coverage. Whereas South Africa has a dual burden of communicable and non-communicable diseases with a high prevalence of HIV and AIDS and tuberculosis. Unlike Nigeria, the country has made significant progress in reducing maternal and child mortality rates, although challenges still persist. Non-communicable diseases such as diabetes and heart disease are on the rise, attributed to lifestyle changes and urbanization. When it comes to innovation and technology, Nigeria is seeing a surge in healthcare innovations, especially in digital health. Startups like LifeBank, 54Gene have emerged to address challenges such as blood supply, logistics, and genomics, respectively. Telemedicine platforms and mobile health initiatives aim to improve access, especially in rural areas, though high internet costs and low digital literacy can also be a barrier. Whereas South Africa leads in health technology adoption in sub-Saharan Africa, the country has been proactive in health with projects like Mom Connect, which provides maternal health information to expecting mothers via their mobile phones. Additionally, the country's investment in medical research and public health initiatives such as the National Institute for Communicable Diseases play a critical role in disease monitoring and response. Now, having compared both South Africa and Nigeria when it comes to the similarities and their disparities, I think it's important for us to also take a look at the challenges and their reform pathways. So, Nigeria needs reforms that address workforce shortages, increase healthcare funding, improve infrastructure, and expand NHS enrollment. Strengthening primary healthcare and encouraging public-private partnerships could drive progress. However, those efforts must tackle corruption and improve governance for sustainable impact. On the other hand, for South Africa, NHI, if implemented effectively, could address healthcare disparities which currently exist, reducing private-public sector inequalities, improving resource allocation, and strengthening the healthcare workforce are also very critical. Tackling systemic issues such as corruption and inadequate management is also very essential for successful reform. In conclusion, Nigeria and South Africa illustrate a spectrum of healthcare challenges in Africa, with each country needing unique approaches to achieve better healthcare outcomes. Nigeria's focus on digital health and innovative startups complement its need for public sector reforms, while South Africa's NHI represents an ambitious step towards universal healthcare access if financial and operational hurdles can be overcome. We appreciate if you like the video and subscribe to this channel so we can reach more listeners like yourself. Until next time, stay informed, stay healthy, and continue exploring the world of healthcare with us. Thanks for listening.
This podcast is sponsored and brought to you by HealthShare Integrated Solutions.